And we've talked before about the Center for Disease Control, suggesting the encampments should not be broken up, but rather the tents should be spaced apart. So the county identified 2 lots that the county owned, 9th Avenue between Jefferson and Madison. Those 2 lots have been converted for safe spacing for tents. This is a voluntary tent distribution plan. We're asking individuals if they'd like to move their tents. And when they do, they're in an area that is staffed, that has security, that has toilet facilities, cold water, and hand washing stations. So that combination of supports is an incentive for people to be moving into the area. We have secured a downtown hotel in Phoenix, and that'll be used also if we need it for more medical care for folks. Medical triage line was established this week. This is targeted for homeless shelters throughout the valley and for hospitals, so that people in shelters, if they identify somebody who may have symptoms, they want to talk to a healthcare professional, they can. If they need to be taken to a different place or from a hospital discharge, we have transportation available now. And so that's a project that was jointly completed by Circle the City and Community Bridges. Those medical facilities are in place now, and you'll be able to, in a few minutes, meet the CEO. He's done amazing work in that area. But before I wrap up, I do want to give a shout out really to the people who are working every day directly face-to-face with people who are homeless. The staff in the trenches have been unwavering in their dedication and commitment to people and are making all these things happen for the homeless population in Maricopa County. Thank you.
Thank you so much, Bruce, for that. And with that, Linda Ross, she is the CEO of Circle the City, and she will explain a little bit more about Circle the City and what their organization does.
Well, thank you so much for allowing me to be here to the county. I appreciate it. So I thought I'd start off today and give you a little bit of information about who Circle the City is and what we do. Circle the City is a nonprofit, federally qualified health center that provides high-quality integrated behavioral health and primary care services to people who are experiencing homelessness, men, women, and children, and that is within Maricopa County. We are the only healthcare organization in Maricopa County that serves solely the homeless population. We provide care in 3 different ways, which I'm going to tell you about. The first is we have 2 outpatient clinics. So those are very similar to what you have when you go to your doctor's office, family practice. Same type of situation there. We have 4 mobile medical units where we take those units out to various parts of Maricopa County and provide care. It's a 2 exam room facility with a small staff that we're able to work with our partners and provide care and basically go to where the patients are at. And it's really providing care to where they are. We also have 2 medical respite centers. We have one at the Human Services campus that's been mentioned today, and also one down on Indian School. And that is a longer-term care facility that has 50 beds each, where people come who are experiencing homelessness, possibly a hospital discharge, and they need greater care. And so they stay with us anywhere from 30 to 60 days. We provide meals, they sleep there, all the things that they're going to need to recuperate, certainly additional medical care, and our end goal is to try to get them housing. So that's what we do traditionally. What we're doing to respond to COVID-19 is we've taken some of our space that we own and that we work with, and recognize that with the homeless, it's really difficult to isolate them. So if there is an issue, you can't just send them home because they don't have a home. So what we had to do was basically create that environment for them. So we worked with our partners, the City of Phoenix, and certainly Maricopa County. And what we have done is we've created at the Human Services campus a place for what we call PUIs, or persons under investigation. And those are folks who may be symptomatic and need to be tested tested. So they're tested and they're awaiting their test results. So it's an isolation place for them. So we have 8 tents with 5 cots each. So we have a total of 40 cots available out in our parking lot behind our respite center and our clinic, with portable hand washing stations, portable toilets, portable showers, cots, AC, because it's getting very hot out there, and pretty much everything that you need. So folks wait out there while we're waiting for their test results. Now, we have had some patients that are positive that have come to us, and we need to have another place for them to isolate. And what we've done is, in our respite center that's on the campus, we've taken a 10-bed dorm, and we have isolated that for positive patients. So that is a place that they will stay until they are clear and ready to go back out and be discharged. So I have some stats for you. So far, and I should say that we have increased our testing because the county has provided more tests for us. So initially, we weren't testing as much as we would have liked. So we started our first testing as of March 17th. So our patients that we have tested so far, and this is just Circle the City, has been 89. Patients who have tested and are positive have been only 1. We have had patients in our isolation dorm that have come to us from various places, and we have had 4, and we still have 4 folks in the isolation dorm. We have had a total number of people in our PUI tents, persons under investigation. That's been 25 people who have come into the tents and have been discharged because they have been negative. So that's really good. And currently we have 1 person in the tents, and we have tested 17 staff members with no positives. Thank you very much.
Thank you so much, Linda, for all that information from Circle the City today. We really appreciate that. Of course, we've been getting a lot of questions into the Joint Information Center concerning people experiencing homelessness, and this, we know there's a large concentration in the downtown area around the Human Services campus. But as I mentioned before, this is an issue that every town and city in the county is facing to some extent, and certainly the county takes a regional approach to try to deal with this problem. At this point, we're open to questions from members of the media who have joined us on the webinar. So do we have a question right now?
We do. Peter Seymour has a question. Peter, your microphone is live.
Good afternoon, everybody. First question for Mr. Liggett. How many homeless people can be treated in the hotel that you're coordinating? And is this a rental? And what other money, a follow-up question, what other money is Human Services asking from the Board of Supervisors at this point, if any, to deal with the homeless who are struggling with coronavirus?
Okay, so a couple of questions there. How much hotel space do we have devoted to this effort? And it's not just hotel space. We also have another space. It's a former hotel, but Bruce can certainly speak to that, as well as some of the funding issues that have gone on so far.
In terms of hotel space, there's a downtown Phoenix hotel that will be used for people who have and need medical treatment. And that hotel holds 28 beds. We also have a facility for people who are vulnerable and at risk in downtown Mesa, and that holds, I think, 25 beds. In terms of the funding for this, these activities will be eligible for CARES Act reimbursement. So at this point, we don't anticipate asking for county general fund support from the Board of Supervisors.
La pregunta fue cuántas personas pueden ser tratadas en lo que existe ahorita al momento de las personas que viven en la calle. Y lo que se ha dicho es que al momento se encuentra en Phoenix con 28 camas en lugares para que sean tratadas las personas que no tienen un hogar. También en Mesa se encuentra con otros 25 espacios o camas para tratar a estas personas. En cuestión de la segunda pregunta era cuánto dinero se necesita que sea aprobado por la Junta de Supervisores del Condado. La respuesta fue que al momento no se necesita, de acuerdo, porque se va a reembolsar los fondos. Estamos viviendo una pandemia y se reembolsan algunos fondos.
So thank you, Joanna. I should have mentioned Joanna Molina, once again here to translate things into Spanish for us during the Q&A portion of this. So we hope that helps out our friends in the media and working for the Spanish language stations in town as well. So Peter Seymour, thank you so much for the question. Do we have another question?
We do. Jessica Bowen has a question. Jessica, your microphone is live.
Hey. Hi, Bill. Hi, Bruce. I'm wondering if you can talk about what is being done in the parking lot with the new relocation space as the heat continues to climb for those individuals, what's being done either by way of shade or other preventive measures to related injuries.
Okay, so the question, Bruce, about heat and what we're doing as precautions in those areas, especially the parking lots that we've now opened up to try to create some physical distancing between the tents that have dominated the streets around the Human Services campus. So Bruce can add a little bit more to that.
A couple of weeks ago when we began the voluntary tent redistricting, we were fortunate to have really cool weather, and it really picked up this past week, so we're aware of that. We're watching that closely. We're also watching the evening temperatures, which are really critical in terms of people's risk for heat-related problems. Presently, there's no more shade structure available there than their tents, and of course, they're free to come and go during the day into shaded areas or to enter the campus. But weather relief and heat relief is going to be something that we're going to have to all, I think, address right now. I mentioned earlier that to take care of some vulnerable people, the campus moved them to another building where they could be safe from the general population because they're so at risk. That was an area that used to be available during the day for people to be able to escape the heat. So this is an issue, a challenge we know that we've got to begin to address. And I think the campus is looking at options, and all of us are trying to see what we can do.
La pregunta fue, ¿qué se está haciendo en los estacionamientos donde la gente se está quedando, las personas que no tienen un hogar? ¿Cuáles son las medidas de prevención que se están tomando por el calor? La respuesta que se ha dado es que al momento solamente existen las tiendas de campaña o las carpas en las que la gente ha sido colocada y esa es la única sombra que tienen. Las semanas pasadas estuvo muy bien la temperatura, no hubo ningún problema. Ahora que la temperatura está subiendo, va a tener que hacerse otro plan. Estamos trabajando en esto al momento. Así que había un espacio separado donde había aire acondicionado, donde había un techo y la gente podía estar. Sin embargo, ahora se está usando para aquellos que están en alto riesgo que con COVID-19. Así que estamos trabajando al momento en lo que se va a hacer con el calor.
Thank you so much, Jessica, for those questions. Do we have another question?
Yes, we have a question from Leon Gonzalez. Leon, your microphone is live.
Thank you. My question is if you have identified more homeless people in recent days or even families, because we've been covering many different stories about evictions, even though the executive order from the governor to avoid those evictions for 120 days, we have people who have been evicted from their owners or their landlords because they don't have enough information. So the question is if you have identified more homeless people or families without a home.
So specifically, but Leon, just so I understand completely, are you tying this specifically to evictions? I know there's been some confusion for the last month on the evictions. I would encourage you to contact Scott Davis at the Maricopa County Justice Courts if you have specific questions about what evictions are still going on and which ones have been stopped due to the governor's order. The evictions that are being stopped have to be specifically because of a COVID-19 related risk there for that family. So I think Scott's a good resource for that for you. But Bruce can speak to a little bit more about whether or not we're seeing more homeless families in particular due to evictions that are continuing.
The causes of homeless are many. Many people have health issues, economic issues, behavioral health issues that lend or contribute to their homelessness. The purpose of all of our activities now are directly targeted at the public health crisis we have and at our response to that crisis. But I'm proud to say that as we do the work that we're doing, we're engaging these people. So the people who volunteer to be moved to a county lot with their tent. We're talking to them, we're asking about their needs, we've seen if they're being assessed, and we're screening them for housing placements. What we'd like to do is that everybody who gets placed into these alternate sites gets evaluated for a permanent solution to their homelessness, which is housing. So we'll be working on that while they're with us.
La pregunta fue que se ha hecho o se ha identificado a más gente o más familias que están viviendo quizás en la calle porque perdieron su vivienda con esta pandemia de COVID-19. La respuesta es que al momento se está trabajando con toda la comunidad en general que está en las calles o que está viviendo en la calle, independientemente si son uno o varios, estamos trabajando muy de la mano con ellos. Y también una de las cosas que se está haciendo es que cada familia o cada persona tiene una historia, ya sea de salud, ya sea porque ha perdido su casa o por cosas económicas. Lo que se va a hacer es que el personal va a trabajar con cada una de esas personas que decida mudarse a estos lotes que tienen carpas donde hay agua, hay baños y diferentes cosas para trabajar uno a uno en su situación personal, ya sea que les den a ellos las recomendaciones para que tengan una casa permanente.
Thank you, Leon, for that question. Do we have another caller on the line? Chad?
We have a question from Anita Snow. Anita,
Okay.
your microphone is live.
Yeah, hi there. I was wondering, can somebody clarify me, because I've heard talk about one homeless person having tested positive, and then there was a mention of 4 people who were recovering or who were in isolation. How many people in Maricopa County who are experiencing homeless have tested positive for COVID-19, and have they all recovered?
So I believe Linda can address at least part of that question. I think we've come across this question before too, that obviously there are people experiencing homelessness all over our county, and our county is a very large geographic area. So some of those people, if they are suffering from flu-like symptoms or COVID-19 related symptoms, they might have gone to a hospital and recovered in a hospital or recovered elsewhere. So Circle the City serves a very large percentage of this group of folks, but I'll let Linda jump in there and kind of explain from the Circle the City perspective what they have seen so far and how many people they're able to touch through their organization.
So I can explain the numbers that I presented. So we get patients and people from all over the county, and we have received people that are COVID positive from other places, whether it be a hospital or something. And the total of that number from a Circle the City perspective is 4. And out of that 4, 1 was tested by us, and that was positive. But I can't speak to any of the other numbers that are happening outside of what Circle the City does currently.
La pregunta fue que si había escuchado anteriormente que una persona que vive en la calle quizás ha resultado positivo con COVID-19 o quizás personas sin hogar, ya sean 4, también han resultado positivos. La realidad es que en este caso Circle the City es una de las instituciones con las que trabaja con estas personas para darles tratamiento médico. Y lo que se ha dado es que los números que ellos presentan, solamente 4 de esas personas han resultado positivos. Solamente se puede hablar en este caso por Circle the City, que es la que está representando en este día aquí.
All right, thank you for that question and good responses there. Anyone else on the line with a question?
Yes, Peter has a follow-up question. Peter, your microphone is live.
Hi there, this is for Linda Ross. How willing have the homeless been for coming to your agency for help, especially with COVID-19? And maybe that's also a question that Bruce can touch upon as well. And then who's on staff for Circle the City in treating coronavirus homeless patients? Are we talking doctors? Are we talking nurses, other medical workers, regular staffers?
Okay, so what kind of staff and how receptive has this population been? I'll let Linda start with that one.
So first, the staff, it's our traditional staffing. So we're using everybody that's in our clinics and our respite centers. So those are medical doctors, PAs, NPs. Of course, we have nursing staff, we've got medical assistants, and we also have integrated behavioral health. So we do have behavioral health technicians that are there to help with some of the questions or issues that people may have if they have some angst with regards to this issue. And they're there to help, settle any fears. Do you want to answer that first?
La pregunta fue que si, ¿qué personal es el que trabaja en Circle the City? ¿Son doctores? ¿Es el personal común del diario? ¿O quiénes son estas personas? Se ha respondido que son doctores, son enfermeras, asistentes médicos, también técnicos, todo para dar un tratamiento completo a las personas que vienen a pedir la ayuda que se necesita.
And I believe the other question was regarding the homeless population and perhaps some reluctance or acceptance, whichever way you would like to look about it, with regards to COVID. Circle the City, that's what we do, is we work with the homeless population. So I think if anyone can handle and discuss this issue with the homeless population, we can do that, and that's what we have been doing. People have not necessarily presented with a lot of qualms or nervousness because I think everyone is doing a really great job with providing information. And certainly my practitioners are doing the same and answering any questions. And we do have things in place now that will ensure that they are isolated and protected and taken care of at this time.
La pregunta fue que qué también han recibido el tratamiento las personas que viven quizás en la calle o que no tienen un hogar. La respuesta es precisamente que la gente tiene confianza porque Circle the City es todo lo que se trabaja con la comunidad que quizás no tienen un hogar todo el tiempo. Entonces tienen esa confianza con la comunidad. También el personal está entrenado para tener esa confianza con la comunidad. Cuando vengan, se les da el tratamiento. Si se tienen que aislar, los aíslan. Están completamente en un lugar seguro que la gente puede confiar.
All right, thank you, Peter, for those follow-up questions. Chad, do we have anyone else?
Leon has a follow-up question. Leon, your microphone.
Just a favor, is it possible to have in Spanish the number of locations available in the Maricopa County to help homeless people? How many locations and where are they located? Thank you.
And Leon, just for clarification, are we talking about the expansion of our services into a couple of different hotels as well as one other facility? Is that what you're looking for?
Correct.
Okay, so just so I make sure Joanna is clear on this, and Bruce can correct me if I'm wrong, but there is a downtown Phoenix location, there is a downtown Mesa location, there is also a facility, a former hotel that was converted into dorm type settings, and the county has rented that at this time. So it's a total of 3 locations right now for expanding our services and to be able to spread out those people that are at the highest risk of having complications due to COVID-19.
La pregunta fue que si cuáles son las localidades que existen al momento para las personas que no tienen lugar y que puedan asistir. Al momento existen 3 localidades, una en el centro de Phoenix, una en el centro de Mesa y también está un hotel que antes era dormitorio, se ha rentado el espacio para proveer el cuidado a las personas que no tienen lugar en este momento.
All right, Leon, thank you for that follow-up question. Chad, do we have anyone else that has a question today?
There are no more questions.
All right. Very well. Thank you so much for being with us today and covering this important topic. To all our friends in the media, thank you for being a part of the webinar, and to those joining us on Facebook or YouTube, we appreciate you being here as well. Of course, we'll send out another advisory as soon as we're having another media availability so we can answer some more questions on public health topics or topics related to human services as well in Maricopa County. Thanks again, and we'll see you soon.